Okay, so this is our counter pressure techniques video. If you pop over to the other video, that's going to be labeled baby movement and pelvic movement during birth. You'll learn about the movement of the pelvis and the way the baby moves through the pelvis. But here we're going to actually just talk about the counter pressure techniques, right? So we know that this sacrum, while we're trying to labor baby down, needs to go like this, okay? And as baby's coming out, it actually needs to lift up and away. So that's what we're going to be thinking about with our hands. Now, there's different counter pressure techniques. You might have been taught a very general, quick one that's mostly for relieving contraction discomfort. And that's okay. If that's what works for you and that's all that you care about, then just do that. But the faster we get baby out, the less contractions we're going to have. So if you can help that baby move out by putting that pelvis and the sacrum in the correct positions, that'll be a better thing. But partner can find those bones at the top, so at the top of mama's waist, so right where the kind of soft tissue ends, you'll feel those. And then you're going to just drop down off of that shelf, okay, right there, and you're just squeezing the pelvis, okay? So you're just squeezing the pelvis in. Now, if you want to do this more effectively to help mama get that baby into the pelvis more, you're actually going to, I'm going to show you my bottom, okay? You're going to find the middle of the bottom and place your hands on these ischotuberosities. These are the bones that you sit on. Now, another quick way that you can do that is follow the femur. So like if she's like this, like where her bottom's up in the air and she's on hands and knees, you can follow that femur bone up kind of at an angle towards her bottom, and you'll find that bone. You might have to kind of squish into her tissue a little bit, but then you're going to find both sides and you're going to squeeze, because as you can see here, as I squeeze those together, it's actually opening up that space a little bit. And then if there's a second person in the room, they could put their hand on the bottom of the sacrum, just making sure that we're staying on that big bony part versus going down onto this tiny little bone. We just want to put our hand kind of lower, and we're going to push there and squeeze here. So then we can see we push there, we squeeze there, that really opens up that inlet. And if not, you just do one and then try the next one the next time. But also just remember that mom might scream at you and she might be like, don't do that, it hurts, or it doesn't help, or like, don't touch me, I don't want to touch. So just mom's dealing with things. She's trying to stay in her head. She's trying to stay in her body. So if she's frustrated or she sounds like she's snipping at you, she's not trying to be rude. So just remember that. And it might be like, oh, that doesn't feel right, so I don't want that to happen this time. So just listen to her, because she knows what's best for her body right then. Now, the counter pressure techniques that we want to do is the baby's coming out, to help the baby kind of really have that nice open space, is squeezing more at the top. So you're going to find those bones like I showed you the first time with that soft tissue, then down onto that shelf, and you're going to put your hands directly on that shelf and squeeze inward. And or if you have a second person in the room, they could be doing another. You probably won't if you're doing a hospital birth, or if your midwives are wanting to be more hands-on, or your midwife could do this, or the nurses in the hospital could do this. They probably won't want that many people like there, because they really need to have access to catch the baby as the baby comes out. But someone, or if you want to try this, instead of squeezing these, just try it with different contractions. So if she's trying one push, try squeezing there. If she's trying a second push, try pushing there. So on one, you can squeeze here, and you can see how that really opens up those bones, right? And then on the next one, you could put your hand kind of just at the top of her sacrum, and then you're putting pressure. Sorry, I'm just trying to make sure that you can see this well. Kind of put your hand like this, and you're putting your palm and you're pushing there, so then you can see how that lifts that tailbone up out of the way. So then if someone else, or if mama at least, has her knees in, that's going to open up that outlet. Huge for that baby just to come on out. No issues there. So if you have any questions, let me know. And that's a great way of just really thinking about the counter pressure techniques. Now, just quickly, actually, you can take a sheet, a really long sheet, just grab one from the hospital room or have an extra one in your room, and you're gonna make it like long as you can get it. So like from one corner to the opposite corner. And then you can wrap it around the pelvis. So you're kind of doing like this, right? And then you'll just kind of wrap it around the pelvis from the front underneath the belly. You'll drop that sheet underneath her belly. And then you're gonna come behind here. And then you're squeezing the opposite direction, right? So you just wanna make sure you got it up on that, those iliums a little bit more. And then you're squeezing, so you can do this versus this for a little bit, because you're gonna get pretty tired of doing this. So you might wanna try something like this. Or if they're in side lying, you can be side lying and then pushing her pelvis to help open up that inlet or outlet, or pushing on the ilium there to help open up the inlet. So hopefully that wasn't too confusing. If it is, tell me what was confusing about it, and I will try to make this video a little bit more clear and concise.